People want to provide good care.
Nurses and certified nursing assistants play a vital role in caring for the disabled and elderly residents who live in nursing homes around the country. So it's probably no surprise that experts agree well-staffed facilities tend to have higher quality care than understaffed ones.
We look at it as a question of life or death for these residents.
Yet federal data show about a third of Utah's nursing homes don't have enough staff to provide the care residents rely on.
Biggest issue is just chronic understaffing, and I did see that.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I'll explain why so many people believe improved staffing is key to improving care in these facilities.
She was strong, independent. She made all of her children, though she's the reason why we're the way we are with our strength.
That's Lessa Fanotti talking about her mother, Lou Toniola, a pair so close it seemed nothing could keep them apart.
My mom just gravitated to where I was at, whether I liked it or not. Yeah.
When Fanotti moved to Utah, Togiola wasn't far behind. Then, after her mother suffered a stroke in 2020, Fanotti made the difficult decision to move her into a nursing home. There were tight restrictions at the time due to the coronavirus pandemic. So Fanotti, a registered nurse, decided to apply for a job at the facility.
Everything was pretty restricted. Visitors weren't allowed, so I just kind of picked a place and decided that I'd work there.
Fanotti had spent most of her career working in hospitals, never in a nursing facility. She says she immediately saw red flags.
There's a chronic issue with understaffing, and that causes delay in care, and this type of system is just so stretched so thin. I feel like that's what ultimately cost her life.
In April 2023, Fanotti received a call from the nursing home where she no longer worked. A scan showed her mother's femur was broken.
My mom's whole left side was bruised. It wasn't just a bruise, it was bruises, multiple bruises along her left side. I was shocked, I was angry. As her daughter, I was heartbroken.
Fanotti filed a lawsuit against the facility alleging there was no documentation explaining how the injury could have happened, especially to an immobile patient like her mother.
And as a nurse, I knew this wasn't something my mom could have done on her own. She completely depended on staff for care.
At the hospital, doctors recommended surgery. Fanotti agreed.
But unfortunately, my mom, she pretty much crashed during recovery. And she passed later that night.
Fanotti's lawsuit alleges, among other things, that the facility failed to provide sufficient staff to meet the needs of her mother and other residents there. The facility has denied allegations of wrongdoing in court filings. We reached out for comment to the management company that operated the nursing home at the time of Togiola's death, but didn't receive a response.
If you don't have enough people to take care of these residents, things will get missed. Mistakes will get made. And those mistakes have very real consequences.
Barry Toon is an attorney with the Elder Care Injury Group, which is representing Fanotti in her complaint. The firm is also pursuing medical malpractice complaints against several other Utah nursing homes, and Toon says staffing often emerges as an issue in these cases.
When you are understaffed and undertrained in a facility, you see more falls, you see more pressure ulcers, greater dehydrations, greater hospitalizations, and that ultimately leads to higher mortality rates.
Federal data shows about a third of Utah's nursing homes have below average or much below average staffing. I've reviewed thousands of pages of federal inspection reports and found more than a dozen examples of Utah facilities cited for inadequate staffing since 2019. In one case, an Ogden facility allowed a nurse to keep working even after she was disciplined for missing narcotics, came to work appearing intoxicated, and was reportedly regularly sleeping on the job, and after a resident raised concerns about safety when she was working. An administrator told regulators the facility couldn't send her home even if she was impaired because I don't have anyone else to work, according to an inspection report. In another case, a Mill Creek nursing home was cited after a laundry staffer was asked to work as a nurse assistant, even though she wasn't trained or certified for the job. She was left alone to cover the floor for 3 hours with no other aid. And in an Orem center, a resident told inspectors the facility was so understaffed that she could be dead and no one would notice.
If you start getting too low in staff, not only are people not reaching their highest practicable levels, but they're not even getting basic care.
Lori Smetanka advocates for better nursing home conditions as the executive director of the National Consumer Voice for Quality Long-Term Care.
And that's what's happening in too many facilities right now because there's not a standard that's being adequately interpreted or enforced.
Her group's research identified a correlation between high staff turnover and abuse. They found high staff turnover is related to issues like poor pay, impossible workloads, and inadequate training.
By putting in place better jobs, paying the living wages, that really would go a long way towards reducing turnover.
The federal government requires nursing homes to have sufficient staff to meet resident needs. A vague standard, Smetanka says, gives facilities a lot of discretion. Her group supported new staffing rules created under the Biden administration, which the Centers for Medicare and Medicaid Services repealed late last year. The rules would have created minimum staffing standards in nursing homes and required a registered nurse to be on site 24 hours a day, 7 days a week. Data from the American Healthcare Association, which was opposed to the rule, shows 30% of Utah nursing homes weren't meeting the proposed staffing hour standards, and about 70% didn't have a registered nurse available 24/7.
Really, only the bottom, the worst of the worst, would be primarily affected and have to raise their staffing levels because there are already a number of facilities that already meet those levels.
Still, researchers at the University of Pennsylvania estimated the standards would create a big impact nationwide, saving approximately 13,000 lives each year.
That's significant.
But the nursing home industry lobbied against the rule. The American Healthcare Association and the National Center for Assisted Living called it an unfunded mandate that could lead facilities to downsize or even close. The Utah Healthcare Association said the rule would cost the state's nursing homes an additional $15 million each year and require them to hire 310 additional staff. The association declined an on-camera interview but said in a statement that the staffing rule was completely unattainable for nursing facilities to comply with, as the state faces workforce shortages. We need targeted investments, not blanket mandates, to grow our long-term care workforce, the association said, noting that it's been working with policymakers to help them better understand our unique population and labor market situation.
To say that a staffing rule that will assure better patient care is going to cripple them, I think is really ridiculous.
But Smetanka pushes back on claims the staffing rule would have been catastrophic for the industry.
But these are multi-billion-dollar industries.
While some groups have celebrated the staffing rule's repeal, others say it will leave understaffing the status quo in many nursing facilities.
Ultimately, I don't see why we shouldn't have higher staffing ratios to ensure the level of staffing appropriate to keep people safe.
Nate Krippis is an attorney with Utah's Disability Law Center. He says if staffing won't be improved at the federal level, he'd like to see the Utah legislature take it on. Utah currently only requires facilities to have sufficient staff to meet resident needs.
If there is a way to ensure better staffing ratios, I think we should. There's no reason why, we should have a lack of staff in a facility that is caring for a vulnerable population.
I'd like to see way more staffing.
Fonoti hopes that by speaking out, she can raise awareness of the importance of staffing and the consequences when there aren't enough nurses and certified nursing assistants on hand.
If this could possibly help any other family, help my patients, that transfer out of the hospital to these facilities, get better care and just hopefully just be a part of a change, a good change.
She says her mother's loss has been devastating, but in the end, it seems not even death has been able to fully keep mother and daughter apart.
On the way here, I kind of whispered as I was walking out here. I whispered, "Mom, be with me."
Do you feel like she was?
Yeah.